Hi, I'm Dr. Christina Wu. I'm a GI medical oncologist. I'm also an associate professor in hematology and medical oncology at Emory University Winship Cancer Institute. Once you have a diagnosis of colorectal cancer, are there any dietary changes and supplementation you can do so that you can be better prepared for treatment and have the best shot at, improving your survival of cancer? This is a great question, and this is a question I have from all my patients. And so I think that what I usually say is that a well-balanced diet with a lot of vegetables is what I would recommend. If you can decrease the amount of processed meats and red meats, I think that is definitely beneficial. And lowering sugar content. I don't know that taking out all sugar from your diet is necessarily going to prolong your survival. I can't say that we've seen studies that has confirmed that. But I do think that if you can take out a large amount of sugary, for example, soda, a large component of that, I think that would improve sort of total outcome in terms of being able to tolerate treatment. There have been some studies where they have looked at, preclinical studies where they looked at mice that might have mutations that can develop cancer, and they looked at high versus low sugar diet, and then it did seem that the high sugar caused the cancers to develop. But I don't know that we can translate that into people as of yet. But like I said, I think a well-balanced diet with a lot of fruits, decreased amount of red meats is the way to go. I get asked about supplementation a lot. I think multivitamin is important to take to make sure that you have all your vitamins. If there's any evidence of anemia, which is a low hemoglobin, we can work you up with to see if you have enough iron, B12, and folate, and supplement if we need to. There is a trial that's going on nationwide. It's a large phase 3 trial called Solaris, SOLARIS. It's a large phase 3 trial where they're looking at for people who are newly diagnosed with colorectal cancer. They're randomizing people to low versus high dose vitamin D in addition to chemotherapy. So for you to know, there are studies looking at supplementation. And so we don't know the answer to that, but definitely that's being researched. I do have people ask about vitamin C infusions because they think that it may help boost immune system. All I can say is I don't know that we have enough data to recommend that at this time, but definitely I think there are studies out there where we're waiting to hear more about to see if that truly helps.